Hello. I wanted to review some of the material from the past week of lecture where we were talking about the HPA axis and anxiety disorders and a little bit about the probing of the HPA axis. So first of all, in terms of anxiety disorders, there are two that you need to know about. The first is generalized anxiety disorder, which is characterized essentially by difficult to control anxiety or worry most of the time over a 6-month period, and then 3 of these list of 6. You should be sort of generally aware of the list of 6, especially actually sleep disturbances, which are common in anxiety disorder and depression. We've already talked, of course, about depression. And then you should also know about post-traumatic stress disorder. It is characterized by all 5 of these. So first of all, there's a requirement that there's an traumatic event, life-threatening or personal integrity-threatening event for the person themselves or somebody that they see put into a life-threatening or personal integrity-threatening situation. And then there are intrusive or dissociative memories surrounding the event. That is, they can't stop thinking about it, or sometimes they become amnesic about it. Persistent avoidance of anything surrounding the event, the location, or anything that's context related to that. Altered mood and cognition, especially surrounding the event, so stress, anxiety, and also difficulty thinking about or remembering the event, and then altered arousal and reactivity in general, so generally speaking, very high levels of stress and arousal. PTSD especially is characterized by an overactivation of beta adrenergic receptors and is sometimes treated partially, at least, along with talk therapy by beta adrenergic antagonists. In both anxiety disorders, so in anxiety disorders such as PTSD and generalized anxiety disorder, and also in major depressive disorder, there is a dysregulation of the HPA axis. We've talked already about regulation of HPA axis in an earlier video, but here we can actually probe experimentally how negative feedback is working in the HPA axis. So remember that there are 3 forms of feedback in the HPA axis. The first is a positive feedback, where cortisol activates the amygdala, which then increases the activation of the hypothalamus and the release of CRH, and therefore the release of ACTH, and then turns up cortisol release. That's positive feedback. Positive not meaning good necessarily. In fact, it's often detrimental, but just that cortisol turns up its own release. And then there's 2 competing negative feedback mechanisms that keep cortisol under control. The first is direct inhibition of the hypothalamus by cortisol, and the second is activation of the hippocampus, which then inhibits the hypothalamus. We can show that in healthy controls, cortisol, that the negative feedback system, the hippocampus and hypothalamus, typically win out. And the way we can show this is that there's a sort of natural circadian rhythm of cortisol, but then if we give somebody synthetic cortisol, dexamethasone, that's chemically different, and then look the next day at the levels of natural cortisol in their body, we see that the levels of natural cortisol are completely shut off because the synthetic cortisol has activated this negative feedback and completely shut off the natural CRH production, and therefore ACTH and cortisol levels are completely shut off. In somebody with major depressive disorder, or at least a large fraction of people with major depressive disorder, this same experimental manipulation of injecting dexamethasone does not completely shut off cortisol. It does decrease it a little bit, but not completely shutting it off like we saw with controls. It's not shown here, but the same thing has been observed with generalized anxiety disorder as well. And so this is an experimental test to show that negative feedback is not working, or rather the observation is that cortisol levels do not go to 0 after a large dose of dexamethasone in people with major depressive disorder. And the conclusion of that is that negative feedback is not working properly or as strongly as it should in people with major depressive disorder, and also in studies that aren't shown here in people with generalized anxiety disorder. We can also link this to sleep disturbances. So looking back first at the control subjects, during nighttime, cortisol levels are low. Again, just now the blue line, not even worried about after dexamethasone, just normal day. Cortisol levels peak right before waking up, again, peak in the evening to keep somebody awake before they go to bed, and then are low overnight. In somebody with major depressive disorder, again, looking at the blue line, ignoring the red here, there are often cortisol peaks at random times throughout the day and night, and this is correlated with, in healthy control subjects, with after falling asleep, deep sleep. The sort of lower you are here is the deeper sleep, and these blue periods are REM sleep, dream periods. If somebody with major depressive disorder, there's little or no deep sleep because there are all these cortisol peaks and many more yellow periods, nighttime wakings, with major depressive disorder. So collectively, this shows us that this cortisol dysregulation is correlated with the sleep disturbances, both in major depressive disorder that we talked about previously and in generalized anxiety disorder.